You are listening to the Baobab Project. Hello and welcome. Thank you for joining us under the Baobab tree from wherever you are in the world today. We are joining you from Halifax, Nova Scotia. We've got so much to explore, from culture to lifestyle to health, relationships, education, and so much more. Now over to our podcast host for today.
Thank you for joining us today, and you're under the Baobab tree. We are currently exploring a COVID check-in. How are Black students doing during the pandemic? My name is Randy Headley, and I have several panelists here today, and I'll ask them very shortly to introduce themselves. Your panelists, could you just say your name and one thing or one or two things about yourself so that the audience can know who you are? I have here with me both staff and students, and today we're just looking forward to having a time whereby we can better educate the MSVU community about the experiences of Black students under this Baobab tree setting. So I'll ask Vanessa, could you start by introducing yourself, please?
Hi, my name is Vanessa Gilbert. I am a year 3 psychology student, and I am an international student from Bermuda. So, yeah.
Thank you, Vanessa. And Timmy.
Hi everyone, my name is Timmy Tayo Balogun. I'm a graduate student of public relations. I'm also an international student, originally from Nigeria.
Thanks, Timmy. And Lisa?
Hello, everyone. My name is Lisa McNeil, and I'm the intake counselor with the Mount's Counseling Services Department, and really happy to be here. So thanks so much for inviting us, Randy. Happy to speak a little bit more.
Thanks, Lisa. And Renaj?
Hello, everyone. My name is Renaj Forbes. I am a sociology major graduating this year. I'm originally from the Bahamas and recently became a Canadian last year. Actually, last month. Sorry. Yeah, thank you.
Thanks, Renaj, and congrats. And Maxine.
Hi everyone, my name is Maxine Brewer. I am a registered nurse and manager of health and wellness at the Mount. I've been in this role for just over 5 years and I'm originally from England.
Thank you, Maxine. So we have the UN here with us today, and we are going to talk about how COVID affected Black students or is affecting Black students. And so all of these various perspectives will help us to provide a rich understanding of the Black student experience during COVID. I also, and you might have seen, I have Lisa and Maxine here with me today to help us to understand how it's affecting the wider MSVU community as well. Let me start by sharing this proverb. It says, if you close your eyes to facts, you will learn through accidents. And today, there's no accident learning here. You will learn about the Black student experience because you'll be hearing it from their perspective, their firsthand experiences, which I hope that many of you who are listening will take and use to help better this community in which we live in. I'm going to start by asking Lisa a question. We're almost 2 years into this pandemic. How has the pandemic affected the students and staff at MSVU?
Thanks, Randy. So I can certainly speak to our student demographic or student population, but I'm sure many of these things might also be true for the broader community here at the Mount. But we know that the pandemic has certainly had significant implications on students' mental health. Global studies, that preliminary research is showing that we're seeing an increase in depressive symptoms and anxiety, gender-based violence, an increase in substance misuse, things like disordered eating, and feelings of isolation are certainly prominent right now with the pandemic. Not to mention kind of a state of the world right now. I mean, we're social creatures, and really thrive when we have that connection with others. So the pandemic has certainly really limited our interaction and our ability to connect with people who, tend to fill those cups. And in some ways, Randy, that's been a real struggle for people, but in other ways, it's also kind of opened us up to new ways to connect, like thinking before the pandemic, we may never have kind of thought to watch movies or stream movies with our friends virtually. So, it's opened up some opportunities to really get us to sort of take a step back and think about ways to connect. And for some who maybe, are a little bit more introverted, the pandemic has, allowed a space for more sort of self-reflection. So I think in many ways, we've had to be a little bit more intentional with our interactions and with having that connection. We've also seen, a lot of grief here within our office. So grief associated with, with loss of loved ones due to the illness, but also, a loss of just activities. So specific to the, demographic of students, just even being able to openly date and just to participate and going out with friends and having those, kind of interactions, there can be a lot of grief with, or not even knowing about the state of, will I get to graduate and walk across the stage, right? So these are all sort of things that are being impacted. I think in some ways on a plus side, we have seen a little bit more destigmatization around mental health because we do know some of the issues are a little bit more prevalent, and there's certainly been an increase in services to students. So things like Healthy Minds Nova Scotia, which is a website that has a plethora of different resources to support students with their mental health. And local resources like the Mobile Crisis Line, the Together All, which is a peer support line, Good to Talk, and our therapy assistance online. So I think in some ways, it's certainly, it's been a struggle. There's no doubt about that. And even from a physical fatigue perspective, there's been a lot of sort of hardship during this time. But I think in a lot of other ways, it has opened us up to getting a little bit more creative about how we tune in and connect with others.
Lisa, you said so much in there. I heard grief, I heard loss, I heard mental health issues that you talked about, but also you mentioned substance abuse, eating disorders, loss of social activities, and all those kinds of things. But then yet amongst all of that, you also indicated that there are other areas where either staff or students might have flourished during the pandemic in terms of, and I think I can reflect on one of our students who said that I really loved the pandemic. It was the best thing that ever happened to me. And has anyone ever said that to you, Lisa?
Randy, I've certainly heard that from students. It has opened up a little bit more time where, we have, especially, during the times where maybe we've been working from home or studying from home. Sometimes that change in routine for some has been really refreshing, right? To have a little bit more time to do those self-care activities or to get outside for a walk in the middle of a day. And just even, I've heard things about, eating habits even shifting in a more positive way, or nourishing our bodies in a way because we have, more access to our kitchen, more readily available, and not having to commute and all of these things. Certainly, I think for some there are, it's not been all bad, right? So there's certainly, I think people who have enjoyed aspects of, what COVID has sort of even given us some time to reflect on things, and the connections in our life.
Absolutely. I'll bring Maxine in here for you to provide your context. Maxine, could you tell us how has the pandemic affected our students and staff, given your context?
Thank you, Andy. So I must admit, I completely agree with Lisa. We've seen the side where it's caused a lot of anxiety and stress for people, and the other side of it where I must admit, for me as a medical profession, I actually saw a whole community come together, and I'm really proud of the Mount for encouraging that. And I know for my side of it, like to be able to provide COVID vaccine clinics and COVID testing clinics to give some reassurance to our community, and seeing what the uptake is on those services has just been phenomenal. I'm so grateful for where we work and the support that we're allowed to give each other. It has been quite amazing. And I know that like for me to be able to provide the vaccine clinics, because I know for a lot of international students it's been very challenging to navigate that. So to be able to provide that and to support international students in getting their vaccine, and then the uptake on everybody across the board wanting their vaccines has just been phenomenal. So yeah, there definitely has been some amazing things that have come out of it, some great coming together, great supports for people. But of course, there's been a lot of anxiety. People get very worried about becoming sick, about what having a vaccine could mean for them, what not having a vaccine can mean for them, and trying to care for people that they care for in their day-to-day lives, when you've got this huge possibility of having an illness that can make people very sick, has been challenging. So there's definitely the extremes that have come from living through a pandemic over the last couple of years. And I agree, like again with Lisa, like we're having to learn to communicate in so many different ways, and I think there's a lot of fatigue in doing things virtually. So there's a lot of supports virtually, but it's really hard for people when you've been working all day in whatever way, shape or form that can be, to then have to reach out to get other supports virtually. That's been very, very challenging. So I know people are really hoping that we're coming to what they commonly know as the endemic at the minute. And I'm really hoping that that's what we're working to. There's still some unknown entities with this pandemic, and really all we can do is kind of take it day by day. But I do be reassured that it is really amazing to see what supports there are out there, and that the university have been a very big part of promoting. I'm very proud of that.
Thanks so much, Maxine. You started to chip away at some of the next question, which is really good, because I wanted to know, what has the university done right? You know, when I reflect on the fact that to sign up, to make that appointment to get a vaccine in a regular setting, it takes so long to get on the website and book a test, book for your vaccine, and so on. But then on Tuesdays and Thursdays, we can simply walk down the hall, and there it is, Maxine standing there ready to provide the same service that it will take me a long time to do online, and I may or may not get the time frame that I want. What else has the Mount done right as a university to ensure that our community stays safe? And Maxine, if you're able to talk about the physical health or the mental health portion, that would be really great. Thank you.
So a great question, and you know, don't get me wrong, it's been a lot of trial and error for what path the university have chosen to take to support what's happening through COVID. However, I do think they've really tried very hard to take into consideration all of the different scenarios that came along with COVID, and there were so many different scenarios depending on what people's circumstances were. So it's been a lot of trial and error, but I really do believe that they've tried to give some time to individuals to make sure that those individuals were heard, and then to try and assist individuals in whatever supports were needed to help them during this particular time. They're very aware of the mental health concerns and how much these have been exacerbated throughout COVID, and they really truly are making sure that they're getting in as many supports as they possibly can. So I sit on a team that have been meeting every week, and at times even more frequently throughout the whole of COVID, to assess what was needed to support students, staff and faculty to get through COVID. So I really do want to reassure people that the Mount have done a really good job at trying to stay on top of public health guidelines, which we know is very challenging because they changed so frequently. So keeping up to date on that was a whole job all of its own. And then also trying to manage people's expectations, people's different scenarios, and being very aware of the mental health supports that needed to be put in place, as well as the physical health side of things. So again, supporting the COVID testing clinic. I have to give a huge shout out. We have a phenomenal volunteer basis to help run the COVID testing clinic, and we absolutely could not stay open if it weren't for people stepping up and volunteering to support those clinics. So again, I'm amazed at the university, but I think I'm even more amazed at individuals, how they've coped through this, what they've done to assist their colleagues, other students to get through this time, because it's just been something we've never really had to experience before. So I do want to reassure people that I know that they're and still constantly working to make sure that we're up to date and supporting everyone in every possible way that we can think of.
Thanks so much, Maxine. That was well answered. And Lisa, I'll ask you the same question, but I just want to, just point out that, the Mount is a very small university, comparably small. The accessibility services and counseling services, across campus, all of our offices are small. Prior to the COVID-19 pandemic, Lisa, your office did an awesome job at taking care of our students, and you continue to do an awesome job of taking care of the students through the pandemic. What are we doing right? And you did make mention to some of these things that, and I'm assuming that you encountered during that time, but you're well equipped for that. So shout out your team if you have to. But what are we doing right, and what will we continue to do right post-pandemic?
Yeah, no, just absolutely, Randy. I think I've certainly got a great team here, but our students here at the Mount are, I'd like to give a shout out to them and their resilience throughout this pandemic that has certainly, we're in the COVID fatigue, right? So I think our department in particular, it's been a really big learning opportunity for us as well, because we were, able to continue to offer supports to students by offering virtual counseling. And, that's turned out to be a really great thing for a lot of people, because it's enabled us to enhance some of our accessibility to our services, right? So we do continue to stay open now, and our office is open in-person to in-person appointments, but we also offer hybrid appointments, meaning we offer phone appointments or video. And that's something that really, became more prevalent throughout the pandemic. But for some students, that's been a really great way, especially for those who are maybe living in more rural communities right now or still studying from a distance. That opportunity to still be able to access supports is huge. So I think that was a really positive shift for our office, is that we were still able to kind of pivot, get our feet, kind of under us, and think about how we can continue to offer support to students. And so, any registered Mount student can access counseling services for free. So students get access to 10 free sessions throughout the school year. So they restart every September, and we work throughout the summer. We've also provided mental health training to faculty and staff, as well as our peer support workers as well, who continue to support students with their mental health. Throughout the pandemic, for those of you who don't know, we also have a therapy dog in our office now, Wendell, who's been just a wonderful new colleague and certainly a popular person here in our office. So we have been offering wellness with Wendell, and we'll continue to do that. He'll be in the library on Mondays and Thursdays. And for those students who are interested, you can follow him on Instagram. His handle is wendell.msvu.therapydog. And you can kind of stay tuned on when his hours of service are in the library. But we know that, animal assisted therapy is really beneficial, especially during these really difficult times. Our office also provides one-day workshops to students. So we've done this before for different student societies, students from the BED program, but we can give this on demand. So it's a workshop, a one-day workshop, where we provide them with tools and tips to be able to support their peers and themselves with their mental health. And then students do get a certificate through the Mental Health Commission of Canada. So, I think certainly it's allowed us to pivot a little bit and think about how we can be more accessible to our students, and to continue to offer those supports as best we can. So it's been a really big learning, but I think, like I said before, Randy, I think in some ways it's been positive in being able to continue to expand our reach. And as I mentioned, more supports even available now virtually for students as well.
Thank you so much, Lisa. I'm just remembering this proverb that we often heard when I was younger. It would say, necessity is the mother of invention. And, it just shows that our offices are inventing and reinventing themselves to deal with the constant changes that occur during this pandemic. So I just want to thank you and your staff for all the work that you've done. So I have this general question. I'll start by asking some of our students first, but staff can jump in at a later point to share an answer for this as well. So Rainaj, I'm going to jump to you now and ask, do you remember what normal was like before COVID-19, the COVID-19 outbreak?
Hi, Randy. Sure. Yeah, I feel like since COVID, I've kind of entered like a time dilation, meaning that like kind of time has kind of like moved like so fast compared to my normal experience of time. So when people kind of talk about like a year ago, I think of, yeah, that's like 2020, right? Like that's like when things were just kind of shaping up and stuff. And yeah, it just really has like, I was talking to a friend the other day and they're saying like, oh yeah, I remember in 2020 when that really big thing happened, right? And I was like, oh yeah, that was when, right, that was when the pandemic, when the lockdown came, right? And they're like, no, like George Floyd was murdered. I'm like, oh shoot, yes, right. Oh my goodness, right? Like just so like, I mean, yes, like that's so in my mind, but like so many things have just been inundated since then. I just can't even yeah, I can't wrap my head around. And also I find that relationships with friends and people are kind of just a bit weird now. Just like asking to hang out has become almost like a political statement in a way, because like well, like COVID-19 has become kind of like a political like statement in of itself, how you decide to navigate the restrictions of the pandemic. I mean, as we can see, so just like, so when you ask someone to hang out, right, like your views on the pandemic invariably have to come out, right? Whether you're okay to actually see people during this pandemic or you're actually, staying put. And, and there's this like kind of like aversion and stigma to disease that so like when you do kind of hang out, I find people quickly saying like, oh, but like, don't worry, I'm like double vaxxed, okay? So it's all good, right? And to me personally, I'm kind of thinking, well, I mean, I don't know, like, what does that matter if you're double vaccinated or not? I just want to know if you have COVID or not, I guess. Like, you know, but yeah, is it this? It's so like it's all these like nuances, these new kind of like social interactions that are just this like negotiation, I guess, of like how to hang out now. It's now here, and I'm still trying to deal with that.
Yeah, that was you raised several important points there. You know, when we meet people for the first time now, and you raised this point, instead of saying hi, how are you, they usually look at you and say, I'm double vax, or they usually ask you, are you double vax? So that is the new form of introduction nowadays. Vanessa, can you jump in there and tell us your memory of what Norm was like prior to the outbreak?
Yeah, I totally agree with what Renaj said like earlier about how like fast time is going, because it just seemed like these 2 years of I'm sure it's been 2 years of the pandemic have just been so like fast. And remembering back to that time of when we didn't have to wear masks in public places, and we were able to travel easily, and we were able to interact with pretty much no stress. Thinking back to the time, it's kind of like crazy to think how time has changed, because you never really know what the next update is now. You're pretty much worried that we're going to go back in lockdown. So having that comfort that I wish I had 2 years ago of just, living life, being able to talk with friends easily and be able to meet others, like meeting your professors in person. That's probably what I miss so much about um, pre-pandemic days. But pretty much like I remember being able to just live freely and live more without constriction. And before the pandemic, it happened like right before my birthday. So I was planning on going out with my friends, like my birthday is the 15th. And I think March 13th was the day where they were like, we need to go on lockdown, the pandemic is happening. So having that experience of, being able to meet with my friends one day and then the next day being completely locked down, it's just crazy to think how times have changed. So yeah.
Vanessa, you will not forget the pandemic for as long as you live. I've had many of those.
Yeah, for sure.
I've had many of those experiences that I will not forget for as long as I live. So I totally get it. Temi, can you jump in and tell us what your memory of Norm was before the COVID-19 experience?
I must say that freedom is really expensive right now, because I remember that before the COVID, everyone, were free to go out, to enjoy, companies of family, friends. And even before coming to Canada, I remember that whenever my parents when they go out and they come back, we're like, stay back, take off everything you have. You guys need to go, shower and clean up and ensure that you're good before you can come talk to, with the kids. So it's you have to live your life intentionally. And back then, we just lived our lives and enjoyed ourselves. So I really miss the fact that I could go anywhere I want to go to. I could, talk to people I want to talk to. Right now, before you talk to anybody, you have to move like, some distance. You have to move back, and before you can have a proper conversation with people. Even when it, coming to, festivity, I had a COVID scare December. I was really sick. I had flu. So I thought it was COVID. I was panicking like it was a serious, I was so anxious. So I miss those times where, you could enjoy Christmas, enjoy New Year, enjoy your birthday. I can't remember the last time, I went out for my birthday because of COVID, so I mean, it was all fun. We took that time. I felt like I took those times when we didn't have COVID for granted. And now that we have COVID, it's really expensive to have, just 1 hour of those time.
Thanks so much, Timmy. I think I separated this question too far from my last question, because everyone is talking and just dreaming about what is going to happen. I want to remind our audience that you're under the Baobab tree, and today our topic is a COVID check-in. How are Black students doing during the pandemic? And I have with me as panels, we have Vanessa Gilbert, we have Timmy, we have Lisa, we have Renage and Maxine. And we're just having this discussion right now. We're at the section where we're talking, reminiscing on what it was like before the pandemic. And I'll just open this up to Lisa or Maxine if you'd like to share anything there.
I actually really love this question because I think it's great to kind of look back and think about what we do miss. And it's funny, I think one of the big things that really strikes me is I've really missed seeing people's faces, like seeing people smile, seeing people cry. It's so much harder to kind of read that in people's body language. It's something that we're, certainly in a lot of profession. I'm sure Lisa will speak to this too. You're very reliant on how people respond to you. So when we have been here every single day on campus, the doctor's office has still been open, but of course, not only am I dressed up, I'm wearing PPE, but the patients have to come in and wear masks too. So you lose that little bit of interaction, and I think it made me really realize and be very much more aware of what my body actions are and what a patient's body actions are, and what an integral part that is of trying to understand what somebody's going through. It tells us so much about somebody's emotions. So when you take that away, you're adding another challenge into that meeting that you have with somebody. And again, just generally, I've really missed when I go through the university, I really miss the noise and the buzz from seeing students and bumping into other people that I know to have a quick chat and a quick catch up, and hearing the laughter and hearing people play the piano at Rosario Cafeteria. Like, it's been really strange to hear that. So I must admit, like, my heart is set on that September is going to be pretty much back to that normal where we get to start seeing each other again, because even though the university is open at the minute, it's still very quiet. It's not what we know pre-COVID, and I've really missed that. And in fact, as each day goes on, I miss it more and more. Like, I'm really craving to have that back again. I really am.
Thanks so much. And you forgot to mention the full elevator and the full hallways and all of these things that comes with.
Yeah, waiting for that elevator down at the McCain.
Yes. Well, thanks so much. Lisa, you want to add something there?
Absolutely. Yeah, I can definitely empathize there with Maxine's sentiment. You know, as counselors here, body language and being able to read a person's face and expression, it, you know, certainly can get challenging when we're wearing masks and taking precautions by using, you know, plexiglass. But even still, I you know, the students that I see in person, we often say it's just nice to be in the same room, right? So even despite the kind of making sure we're taking those precautions, for some it's just even nice to kind of be in the same room. And you know, you start to really glean a lot from a person's eyes, right? So I think that's been, and to what the students were talking about, you know, I think so important is this notion of, you know, kind of that unpredictability, right? I mean, it's I've heard someone say on the radio the other day, it's not the first 5 kilometers of a race that are the hardest, or a marathon. It's not the last. It's this section sort of right towards the end where you can't yet see the finish line, but you know it's kind of around the corner. And they use that analogy as sort of where we're sitting right now with COVID. I think we're all really hopeful, and that hope piece is huge right now, that we are turning the corner, that, the endemic is near. But we're still a little bit, I think, nervous to get our hopes up. So dealing with that unpredictability, the uncertainty, the changing nature, the everyday changing nature of COVID, and how rapidly things have shifted in our lives, it's certainly, called on all of us to be adaptable and to be, resilient, and to think about ways that we really can sort of make the best out of a really challenging situation. And one of the things that, I hear a lot of is even just this notion, and I feel it wholeheartedly in my personal life, like it can get really difficult when you don't have those things that maybe you would normally look forward to, like, oh, that trip that's coming up, or even going for dinner with a friend, or just getting out for that walk, or doing something. So, seeing family and all of those pieces, especially for our international students, right, where they are maybe away from friends and family. So I think that's been a really big struggle, is just that not knowing and not being able to plan, or to have a sense of control or predictability over a situation, can get really tiring, can get really exhausted. So I think all of us, our cortisol levels, we are physiologically feeling the effects of this. So I always say, focusing on the things that we can control right now, because so much of this pandemic is out of our control. And, continuing to find little areas of gratitude, or little areas of joy, even if it's, getting out and walking to get a coffee, your favorite coffee, or making a coffee and just sitting for a moment, journaling, whatever those things are that can give you small moments of gratitude, and establishing, some rituals and routines in your own life right now can be helpful pieces, because there is just, a whole lot of unpredictability that we're being faced with.
Thanks so much, Lisa, and I'm really glad I asked you that question. You made a really good analogy of this as being a marathon, and we're just around the corner. And we're thinking about what we will do when we get there. And I'm not thinking about the excitement part of finishing, throwing your hands up in the air in laughter and all that. I'm thinking of after that rush is done, and you have to continue living on. So this will be our new norm I'm talking about. What would that look like for you post-COVID? Briefly for our panel members, I'll start with Timmy. And Timmy, after you've spoken, then anyone else can just jump in and talk about what do you anticipate the new norm to look like post-COVID?
I'm looking forward to, having, like Martin said, having to interact better with people. Like currently now, when people express themselves, you can't really see the expressions, because we're all wearing face masks. I'm looking forward to having, lectures back in class, because, having lectures online and in person are two different things. So I'm looking forward to having lectures back in class, with introduction of probably new technologies, and to improve the learning process. I'm looking forward to, having the beautiful society, interacting with people, meeting people, having new international students, people migrate, people come in, and also, meeting them. Because I came in during COVID, and it's been difficult, getting to meet people, interacting, socializing. So I'm looking forward to, meeting people, knowing, enjoying the environment to the fullest, not being restricted, enjoying the environment, meeting people, going back to class, even work, going back to work and all. So I'm looking forward to a new norm, introduction of new technologies, because I feel like the scientists must have been building new things. So I'm looking forward to new technologies, to improve and make our lives better.
I can just jump in there too. This is Renash speaking. Yeah, I think so. The question I have in my mind was the how do I anticipate this new normal will look like post COVID? And just been thinking about this question. I mean, like, because I think that we are already in a post COVID society. I think that for a long time we will divide our lived histories into before COVID and after COVID, and we're already like, well, like after COVID started, right? And I don't know, and I think that like, and why I say that because I think that I don't know, like thinking of just like the way the restrictions, like for example, has been eased, right? Like, I think that it's a manifestation of the like of the idea that okay, well, COVID is here to stay, so we might as well live with it, I guess, and go on with our life and whatnot. And that's precisely what people is going to do. So I don't know, like I think yeah, like I think we're kind of already in it. I feel like obviously our normal and going back is like independent of whether COVID goes away or not, as far as I can tell. So I don't know. Like I mean, I think that with that said, I mean, I think that there still be kind of like I don't know, like um anxieties around, but I don't know if it'll go back. Yeah, like a new normal. I don't know if it'll go back to the same normal, but I don't. We'll see.
This is Vanessa speaking, and I feel like I want to experience my university experience post COVID more because earlier we touched on how it's hard to socialize and meet new people with the pandemic, and we are encouraged to like stay inside all the time, which is the best solution to, mediate the spread of COVID. So I look forward to, actually going out with my friends and having a good time with less anxiety. I don't think the anxiety will ever go away, but I feel like just having the comfort of being able to go to the pub and study in the library with my coffee in my hand, because right now you can't really drink or eat in the library. So being able to study with some coffee and with my friends around, we're laughing and seeing a lot of the students around because the university is a little empty. It's still pretty active right now because we are in that phase of transitioning back to the new norm. But having to see different students, because a lot of international students decided to stay home because of the pandemic. So being able to even interact with more international students, and I'm also looking forward to, traveling being way more easier, because I don't know if any other international students have had this, this problem, but travel is very, very hard right now. Like even, all the requirements that you have to, have before you travel, the anxiety of maybe catching COVID while you're traveling. I feel like I can't wait for that to happen. And yeah, that's pretty much what I look forward to, just having less anxiety and being able to, freely move around without being so paranoid all the time. But like I said, we are transitioning into that phase of, going back to our new norm. So I'm excited for hopefully next September I get to experience more of the university life and interact with people.
Thank you so much, Vanessa. So, the COVID-19 pandemic has increased our dependence on the internet to access work, our services, and school. It was also instrumental in showing us the deepening digital divide between the haves and the have-not. And further, it showed how many standard policies and support weren't necessarily serving those who needed them during this pandemic. There are so many other divides that societal divides that I can list that COVID reared its ugly head and showed us. And I need not mention them all here. But how has the COVID-19 pandemic affected you? I'm looking for, a more personal take on how it affected you as a person. And this is for, I guess I can start with Renage on this one.
Thank you for the question, Randy. Um, yeah, I'd say I'll touch on academically. COVID-19. Yeah, I guess like I was one of those people that. Well, actually, I started MSVU in the middle of the pandemic, like so last winter. So I don't really have that much to compare before, but I mean honestly, like it the format has been really good for me. The like online classes and stuff has been really good for me in terms of like participating in class. I find that just the whole setup of having a live chat, during a lecture to like hear students' thoughts and to share your thoughts, to share like links and stuff to websites, like to a video or whatever. That's been really useful. Actually, it makes class way more interactive in that way. Well, actually, yeah, it does actually, and I think me personally too. Like I do miss out on the like interactions with professors, which actually help me to learn, like that kind of like one-on-one interaction and like being able to kind of sit down with them and talk with them. I mean, like, yes, I can do office hours, but sometimes like you kind of just want to raise your hand and chat with the professor kind of thing. But I find that professors have responded pretty well in terms of like so because I feel that like some of the communication between professor students like has like some of the information because it's like online or because it's whatever, like you can't get to like nuanced with the teaching and whatnot. So I find that their assessment also reflects that as well, and like it takes like kind of stress off the students. So like they'll probably do like yeah, so I guess like they'll do more of a multiple choice question or a multiple choice exam rather than like full short answers where you have to like really detailed and explain, right? So as long as you understand the concepts. So yeah, like and also like not having kind of like timed quizzes and stuff like that where like you can actually do it on your own because so many people do now have different like commitments, different technological situations and whatnot. So that's been pretty helpful. So yeah, like I think yeah, that's been my experience. It's been positive in that regard.
Thank you, Renaj. And Vanessa, I heard you talked about, the mental stress. Could you further explain how this pandemic has affected you, and if you can touch a bit about the anxiety and those kinds of things to help us focus on that aspect of how the pandemic affected you.
Yes, I am pretty as introvert as you can maybe say. I am pretty much to myself. So sometimes like when I go to like even now in classes, if I have like more than 45 people in a class, sometimes I start to, have like headaches because I'm not used to a lot of people being in my space. So sometimes the anxiety of, possibly catching COVID, and I feel like we all have that experience where we got a little cough or a little like tinge in our throat, and we're like, oh no, like we start getting anxiety that we have some symptoms, and then that might cause for my brain to run wild. But mentally, I've actually, even though I've had anxiety, I feel like mentally I was able to with support from my friends and my family, help to mediate some of those anxiety factors, and being able to communicate so easily, like through phones and through technology nowadays, it really is helpful for protective factors against things that may invoke anxiety for me, especially in a time where we are being isolated all the time. Things like that can really help to, make me feel better and make others feel better, because we are always communicating. We are socially, we are wired to be social human beings. So being in a technological age, it really helps that we are able to communicate so easily. And mentally, right now, like from the start of the pandemic, from now, I've definitely improved because, as I said earlier, we have been isolated. So maybe more so when we were in lockdown, it was a little bit more mentally taxing. I remember in the summertime where we heard about stories of George Floyd, and on the newspaper and on the news stations, it was very primary. That was what we mainly saw. So I remember I saw my mental health deteriorating because I was seeing the anxiety of the Black Lives Matter movement and seeing how the police were treating their society, and how it seemed like all the uglies of society was exposed during that time. We were able to blatantly see in front of our eyes the systemic racism that was happening during not only the pandemic, but what's been happening for 400 plus years. So I remember during that time seeing such negativity of, people not taking our experience seriously, people always minimizing our experiences as Black people. I took that time to really look into myself and learn about my own history and become more empowered within myself, because I was able to take that information and I was able to educate myself about what had happened in the past. There were a lot of things that happened that you really didn't learn about on a daily basis. Things like the Tulsa incident I didn't know about. And during the pandemic, gave us an opportunity to finally stay still and be able to educate ourselves. So even though I saw my mental health deteriorating during a time where I was seeing such sadness on the news every day and seeing such things that got me frustrated, it helped me to alleviate some of that anxiety and that, depression that I saw, because I was able to educate myself and become empowered. So now, as we have been educated about things that happen to us as a Black community, years and years, that's continuing to go on today, it really helped to alleviate some of that depression and anxiety that I've had today. So I was very, grateful for that experience, that I was able to become more aware of such situations.
Thanks so much. Um, I'm just going to ask Elisa to jump in because I know she has to leave relatively soon, and if she wants to wrap up with anything and leave any comments, Elisa, could you take the mic now?
Yes, I hate to leave right now, Vanessa. What you just said was so powerful, and I think such an important piece of this dialogue. And I'm sorry I have to step out. I do have a session starting shortly, but just what you were speaking about with the kind of collective heaviness, and so glad that you were able to kind of find some peace and serenity and being able to use that time and just reflect and advocate. And I think that's such an important message. So thank you so much for sharing that experience. But yes, I just really, more than anything, really hate to leave. I think this has been such an interesting and engaging conversation and dialogue, and we feel really grateful from the counseling team to have been invited here and to have been a part of this discussion. So thank you. And if students are looking to make an appointment, they can drop by our desk, our front desk in EMF, the bottom floor of the library, or email counseling@msvu.ca, or call 902-457-6567. And this information is on our website as well. But thank you all so much, and I hope that you enjoy the rest of your conversation. Thanks again, Randy.
Thanks so much, Lisa. And I just want to remind our audience that we're under the Baobab tree, and today we're talking about a COVID check-in. How are Black students doing during the pandemic? I'll say that part over again. I want to remind the audience that we are under the Baobab tree, and today we're talking about a COVID check-in. How are Black students doing during the pandemic? And I have several panelists here, and I'm good. Maxine, I'll turn to you for this next question. What advice would you give to students to help them prepare as we slowly reinsert ourselves back into society?
Thanks, Randy. So I think Vanessa again brings up some amazing points, and thank you for that so much, Vanessa. One thing that I think we hear a lot of, and Vanessa spoke to this too, is just general people's anxiety. So one thing I've kind of learned is what we really do need to concentrate is because we do tend to get very engrossed in what other people are or aren't doing with regards to COVID. So one thing I really want to stress to people is if you know that you're doing everything that you can do to protect yourself, then the chances are you'll do really well getting back out into to the university opening up and your own life opening up to start doing things again. So do remember that. I mean, if you're able to be vaccinated, or even if you can't get vaccinated, if you're wearing your masks and you're looking after yourself, and if you're not well, or you know people aren't well, that you're sort of caring for them from a distance, then those are all the things that we could ask for during a pandemic. So just remember to think about what you're doing to look after yourself, and that will usually pay an awful lot of dividends, and will hopefully then, if you can then talk to yourself and say that I know I'm doing what I need to do, that will really help with your anxiety, because as long as you're wearing those masks and washing your hands and being cautious about where you're at with people, then that will reduce some of the risk that you will have with being exposed to COVID. And again, I know I've very much trusted in our public health. I think they've done an awesome job. It's a very new world for everybody, even the people that have to put those guidelines in for COVID. It's still a very new world. So do make sure trust in that too, and I think that will also help with any anxiety. But look forward to some lovely weather coming. Make sure that you get the opportunity to get some sunshine on your skin and enjoy the warmth on your body. And so make sure that you do get the opportunities to get outside and get some fresh air, and enjoy the summer. Because I think there is a bit of unknown entity with September coming around, because we just can never still be quite sure what COVID is going to do. I think the anticipation is that it will start declining quite nicely now over the next few months. And so make the most of getting yourself out there and doing things that you enjoy, that make you feel good and give you some reassurance.
Thanks so much, Maxine. Vanessa raised some very important point, taking into account race. Maxine raised some very important points, and taking into account public health policies and all that the entire society needs to do to as we ease ourselves back into our new society and our new norms. There's something in the middle that needs to be explored. And Timmy, I'll ask you that same question about what advice would you give to students? Because you came here during the pandemic, and you've learned how to cope in this new cultural setting during the pandemic. So what advice would you give to students to help them prepare as we insert ourselves back into society? And I'm thinking both international students and those who have been locked down for a while. I almost said locked in or locked away for a while. How would you advise our new students?
So first, I would say that just be prepared first, and try and speak with people. You know, um, I'm thankful for the Black Students Association. I mean, I can't say that Randy has been so much of help. Randy, Ajoke, so if you have people like that around, so try before coming in, check international students office. You can send them an email so you can have people to speak with. I quarantined for 14 days and I was able to speak with them, and I think they gave me, they prepared me ahead of what I was to expect. So I just had I was not expecting too much because I had spoken with them already. Coming in, I thought was going to be a different case here compared to my home country. But, speaking with them during the lockdown, I mean, they helped me. Then the Black Student Association, I didn't feel alone in a community that I'm new in, because I had people who looked like me, people who look like me that I can talk to and would understand my point of view, where I'm coming from. So for new students, I would say that try and find, associate yourself with international student bodies. And again, try as much as possible to stay safe. I know it's not easy, it can be overwhelming sometimes, but you need to stay safe for yourself, because if you look at it, it's just you here in the real sense of it. So you need to take care of yourself. So, and also you could join uh groups. Like in class we had reading groups, so you could also join those ones. Try and associate with one or two people in class. If there are people that you feel like their comments are good for you, their comments makes a lot of sense to you, and you would like to associate with them, reach out to them via email. Tell them you would like to, probably read with them, you have questions for them and all. And also feel free to reach out to your professors, but most importantly, reach out to the international student body. And also, if you're Black, please reach out to the Black student body also, because that was really helpful for me. So I can overemphasize the help I got from the Black Student Association.
Thank you so much, Timmy. We waited and hoped for the lockdown to be lifted almost every time Public Health published an update. We see Dr. Strang and the premier stand on our set on our television, and we just hope that they'll say the lockdown is over. We know it wasn't going to be over like in an instant, but we were still hoping. However, changing public health rules made the wait feel like we were on a roller coaster of some sort. It's like this ride through this pandemic has really affected a lot of us. And Vanessa had mentioned, talked about the anxiety already. So we want to touch on that right now. And Timmy just talked about some of the self-care aspects that we do need to take into account. But how are we dealing with this constant changing and just overlooking everything else that happened and the pandemic itself? How do we handle this constant change in the rules surrounding the pandemic? Anyone can jump in there for that one.
Okay, let me see. So this is Temi talking. So I mean, it got to a point where I became anxious to check the news. And I feel like a lot of us, go through that, because there's always some sort of sad news, new changes. In all, we have to accept our reality right now. We have to accept our reality, that this is what the world is going through. Nobody has ever been through this before. We're all going through it at the same time. So accept the reality. You need to check it no matter how scared or anxious you are. You need to check it so you can be on top of your game. And so you don't fall into, you don't go, how do I put the word? If there are restrictions, you need to know about it. So you need to read about these things so that you don't, break the rule. So you're not one of those who would be punished or penalized for breaking the rule. So I feel like adjusting also means you need to stay updated. It can be scary. You might be anxious, but you need to stay updated. You need to face reality. Stay updated and ensure that you're following the leader roads. That would help you, once you take it a step at a time, it would help you, to integrate perfectly into the new rules.
Go ahead, Maxine.
Hi, Timoteo. I think what you said was just awesome. Like, again, I'm just constantly so thrilled to hear how people have managed through COVID. And you're right. I mean, hearing those changes, and especially when we went through that period of time where it felt like there were changes almost every other day. And I know as a medical profession, and also seeing the challenges that brought on for the university to manage was super challenging. However, what I really loved was, again, and I do primarily think of students really took all of these things in their stride and were from the students that I interacted with were so willing to take part and to listen and to know what they needed to do. Like, I think that's just, it's very reassuring, it's very heartwarming to know that everyone is stepping up to care for the community. And again, I know I made reference to, like, when we're thinking about anxiety, about just making sure that we're doing what we need to do, but ultimately what that often means is that it pays dividends for our whole community, and we do have to keep in mind that this is a pandemic. It's not about each individual person, it's about what we do together collectively. And I mean, even caring for the students that live in residence, I mean, the amount of students that have contacted us with their concerns, letting us know that they've been exposed to COVID or even tested positive to COVID. I was always so thankful that they had the courage to reach out and tell us, because it meant that we were able to step in, help care for them, help manage a bigger exposure happening. So I was always blown away by how great the students were about accepting and trusting in what they needed to do. I just, like, a huge thank you, huge kudos to you all, because I know that the changes have been challenging. Like you say, the impact that it's had on school, the impact that it's had on personal lives, not seeing family, not seeing friends, loved ones. It's very hard, and I know that as well as an individual. I have family in another country. I have family that live in other provinces here, and it's a little frustrating when you got to a point where you thought you were going to see somebody, and literally the day of or the day before, you're being told that you can't do that anymore. It's quite heart-wrenching. And so, to hear what you're saying about how you kept yourself up to date, I just, like, again, thank you. It really is awesome to see how people embraced COVID, and knowing that what they're doing is to not only care for themselves, which is hugely important, but it ultimately means that we're caring for our community. And I just think that's wonderful.
Thanks so much, Maxine. You said it really well, and I don't think I have to add anything else to that. So thanks for that, both you and Timmy. So I'm going to introduce another panel member right now. This person will speak to someone who had the experience of contracting COVID. I don't know if any other panel member has had COVID. I didn't ask anyone else, but I'm bringing in an expert who had COVID, and I want to find out how they've dealt with it. We'll explore things like stigma, and she'll be able to talk about quarantine and recovery and all these kinds of things. So let me start by introducing Naomi. Naomi, can you just say something about yourself briefly for us?
Sure. Hi, everyone. My name is Naomi. I'm a recent graduate from Mount St. Vincent. I majored in sociology and anthropology. I graduated like last year, May, and I'm originally Nigerian. I've been here since 2015, and that's basically everything about me.
Thanks so much, Naomi. And she forgot to mention that her and I sat down in Bedford there and thought up this whole idea about the Baobab Project. So this was our baby in the making, and the baby is all grown now. So Naomi, can you talk to us about your experience with COVID, and further just talk about the stigma, quarantine, and recovery, and anything else you'd want to throw in there?
Sure. So I found out I had COVID, I think the second week of January. I had gotten it from a friend. Uh, I had tested before, so I tested on a Tuesday. My results came back negative, so I went back to work. But by I think Thursday, I said I have symptoms. So I went back to retest, and then on Friday I found out that I had COVID, so I had to be home. I think 10 days to resume back to work. Quarantining was interesting, and I say interesting because like we've been in quarantine before, but I feel like this was different because then now I had COVID and I couldn't go out. I had to be careful with who I was letting in my home. I had to quarantine from my sister who lives with me, um, which was really hard because it's like we stay in like a two-bedroom apartment. We stay in like a two-bedroom apartment and we share one bathroom, so I had to like wipe down everything I touch, which was very, very difficult because I didn't want her to get sick as well. When it comes to the stigma of having COVID, I really didn't think that I would have any stigma because I felt like it was getting very rampant and almost everybody was getting COVID. But I did have like a problem at work when I was working with one of my clients, and I was talking on the phone with the payroll at the office, and they couldn't hear me. So like I took down my mask for a second to explain what I was saying, and apparently my client got really upset that I had my mask down. And then I was okay. I was okay to go back to work. I had done my rapid, I had done a PCR test. It all came out negative. Um, I had gone to the hospital and done all like the test from the doctor for me to go back. But she got pretty riled up with the fact that my mask was down for a second, and she sort of like yelled at me for it and said she didn't want my COVID DNA to be in her house. And it was very weird because I didn't expect someone of that age to say such a thing to me. And it became like a big thing for us working together in the situation because I've had COVID. But I think that's the only stigma that I faced from having COVID. I mean, I had people ask me how it was, and I got tired of answering the question over and over again. Um, but yeah, I that was a very different experience for me. I never thought that I would get COVID because I was very careful. I would wear my mask. I would sanitize my hands. I would wash my hands every time I walk into the house. But like stuff happens, right? And I don't think that we need to label someone the COVID person in quotes because someone got COVID. It doesn't make you less of a person, I guess. But yeah, that's like my story in contacting COVID and how it went through for me. I don't know if there's any other questions that you guys want me to answer.
Oh, thanks so much. And just note, I didn't just bring you in here just to hear what your COVID experience was like. You're a vital part of the conversation. And I just thought that it would be really interesting to hear firsthand what your quarantine experience was like. And you shared some really good detail information there and the stigma around it. Because students, and Maxine made reference to this as well, that within the Mount community, it's because of people like yourself who would declare, hey, I have COVID. That is one of the reason that many of us are safe, because people said publicly, I have COVID and I'm now going to quarantine. So we are really thankful for those who've done that. But this will also clear up things for many others who might be thinking of traveling, and just to let them know that, look, we're coming to the endemic period, and it will be a time when you will be able to travel, you will be able to enjoy your campus, you will be able to have fun with your friends and so on, without that notion of, hey, a COVID person is in the room, I got to put on my mask or I have to leave. So I'm really thankful that you were here to share that information. Um, so what kinds of support, and this is for Vanessa, I'll ask you to answer this. What kind of supports did you receive from MSVU as a Black student? And this could be from the Black Student Support Office as well. What kind of support did you receive during the pandemic that really helped you?
So during the pandemic, I feel like the Black student support really helped with offering opportunities, especially bursaries, especially during a time where our tuition has increased. So like getting the opportunities and getting the emails every week saying that you are able um, to submit your scholarship, and the Black student support even help with job opportunities. So I found that that really helped. And even when we were able to have our discussions, you're able to the Black student support is a place where you can walk in, see Randy, and you can always have a conversation, especially if it has something to do with either your volunteer hours or if you just want to have a conversation. I found that that really helped, especially now when I could just walk into your office, and if I have something, wrong with me, you're always able to listen to me, and always I'm able to voice my concerns in a comfortable space. And yeah, that's pretty much the Mount St. Vincent of University has also offered counseling services. Maxine is very open about coming in for testing. I know I had to go as an international student, we have to travel a lot, so it was easy to get testing from Maxine. And yeah, that's pretty much all the support, plus more that probably others can mention, but that's what directly impacted me.
Thanks, Vanessa. Renash, can you jump in there and share some of your some of the supports that you receive?
Yeah, actually, one thing that just kind of really stood out to my mind was that Black student support like really offers like a really good place to de-stress, and I had the opportunity to beat some drums with Randy, and and also like kind of offered like a little bit of a lesson too, and like rhythm for me who don't have any. So yeah, it was, yeah, it's, and I mentioned that like, and I'll just leave it like just like by itself, because like even though that's like it seems like a small thing, but to me it was such a big, it's such a big thing, like just like de-stressing, something to do, something to kind of be involved in. So yeah, that really helped me. If you want to learn to beat drums or anything, go to Ronnie's office.
Please stop promoting Renash.
You have a long line after that.
Oh gosh. Yeah, so I'm coming to the end. We're coming to the end of this podcast right now. I think one of the things that we do need to further explore is that end that we're looking at, right? So, what would you do when the everything is over, in terms of the government says the pandemic is will probably go on in other places, but in Canada, we have lifted all of our lockdown rules and so on. What are you looking forward for? Maxine, I'll start with you on this.
Oh my goodness, that's a really great question. Oh goodness, I'm not sure I can even begin to think what I would what I would want to do. Work-wise, I think I'm excited to have everyone back in the university, and because it's such a great experience for everybody, from students to staff and faculty. So I think I would love to see that we maybe do a day at the university where we really celebrate that we have no restrictions. I think you're right, though, that I think, COVID is going to be with us for a fair little while, but I think it will come along the lines of influenza that will be managed with maybe different COVID vaccines over the next few years. Personally, I think, again, from what I'm hearing from a lot of other people, the freedom to travel and feel maybe a little safer traveling. I think one of the big concerns I would have worried about for me for traveling is not so much being exposed to COVID, but not being able to leave the country I had traveled to be able to come back to Canada. I think that for me would have actually been the biggest fear that I would have had if I'd traveled. So looking forward to traveling and knowing that we can travel wherever we really want to go and be able to come back and not think that that could actually be a worry for us. So that would be to celebrate, to get back to the UK, to see family, to see my family in New Brunswick, and not worry about getting there and getting back in the time frame that I would like to be able to do it.
Thanks so much, Maxine. You were stumped at the beginning, but you did really well on that one. I think that's the dream of everyone. We want to travel, and we want to travel without the quarantine or restrictions placed on us. So I think this is the dream of everyone. Vanessa, I'll jump to you on this one. Besides having a really good birthday party, what else would you want to do?
That's funny. Um, I honestly, it's crazy to think about what the first thing I would do. I guess um in respect to what I intended to do before I was shut down, I was planning to go to the trampoline park before the pandemic cut my plans out. So I guess the first thing I guess I can do that now because the restrictions are less, but being able to invite my friends out, I guess, for my 21st birthday and go to the trampoline park and just laugh and enjoy each other's company with less anxiety would be amazing. Um, and I feel like I'm still gonna wear a mask for a while, so I'm not gonna go outside and just throw my mask in the air and be like it's gone. But yeah, that's my plans to just go trampoline world. I mean, jump trampoline park.
That's that's a very good plan, and I can just envision trampolining with mask. Right, this is just going to be an exciting time.
Yeah.
Naomi, would you want to tell us post COVID? What are you looking forward for?
To be honest, I'm looking forward to just being able to travel. I know someone has said that before, trying to go home and not having to do all this tests and pay all this money to get tested to travel. I'm also looking forward to be able to hang out with my friends and just sit in the coffee shop without having to wear the mask and then also be safe, right? Because that's very important. But yeah, I'm looking forward to just going back to normal, which is funny because I don't think I know what normal is anymore. I don't think we've been normal in the last 2 years, so it's kind of hard to figure out what normal life looks like without COVID. But I just need to get back to the point where everyone is comfortable, everyone is happy, everyone can do what they want, see their loved ones, do not have anxiety, depression, because I feel like the last 2 years have been filled with depression. But but yeah, that's what normal looks like for me.
Very good points there, Naomi. And Renaj, can you jump in there with that question? What are you looking forward to at the end?
Yeah, actually, if you don't mind, I really would like to answer the question that we had about like what yeah, just about like what kind of like suggestions kind of like I want to see, yeah, what support I like to see in place for my eventual return to campus, if that's okay.
Yeah, absolutely.
And yeah, so one thing I just want to quickly say is just that, like, I guess like hand sanitizers around, right? Like, I mean, like, preferably one in front of every classroom, or like even in the bathroom as well. And also, I want to see like some lotions dispensers around too for dry hands after the excessive washing and stuff, right? Especially for Black students, right? Like we know that we get like ashy. So also like the disposable mask, like to be available as well would be nice so that you can, like sometimes you come to school and you have a mask and becomes dirty and that'll be great. So yeah, and also one last thing is that like I honestly like right now like I use the library a lot just because like right now a lot of work is like independent. So I use the study rooms and I just have a hard time with like kind of like the one person per room rule and also like the 30 people, sorry, the 3 hours per day rule. Like I just find that like a bit like paradoxical since like we kind of like have to be crammed into a small classroom with like 30 people I don't know with like poor ventilation for anyway. So like and yeah, yeah. So I guess like those kind of things would be kind of nice to kind of think through for them out to kind of like, help students like transition back. But yeah, anyway, that's what I wanted to say.
Thanks so much. And I see many of your colleagues have been agreeing to many of the things you've said. And Timmy, do you want to wrap this up and tell us what you're looking forward to in terms of celebrating when we get to the end of this pandemic, whenever that time comes?
Okay, I feel like it's been said though. I'm looking forward to exploring Canada because it's just been me here in Bedford, down to Halifax, Bedford, Halifax School, Bedford. So I'm looking forward to exploring Canada, not being worried about restrictions in different provinces because reading the news, I see that different provinces have different restriction processes. So traveling, going back home to see my family and having it at the back of my mind that I can still come back. I won't be held down in my home country, not coming back, basically just traveling. I want to travel and enjoy my time wherever I go to without the nose mask. I'm looking forward to burning all the nose mask I have and enjoying my freedom.
Those were some really different endings I'm hearing. And, Timmy, I'm glad that we ended with you because you made some very good points. What are we going to do with all of those masks? And you're looking to have a mask burning party. Invite Vanessa, and that will be awesome. So I want to thank you all for participating today. You've been a really good source of information on the Baobab tree today. A COVID check-in was our topic. We explored how Black students are doing during the pandemic. And today, our panelist was Reynaj Ajoke. Ajoke actually was in the audience. Maxine, Lisa, Timmy, Vanessa, Naomi, and we really had a really lovely discussion today, and I appreciate all of the information you shared with me.